Welcome to Have More Babies, the show where we get into the essential stuff you need for this whole parenting journey. Today, we're looking at something really critical, maybe a bit overlooked sometimes. Children's eye care. Did you know that a huge amount of what kids learn, maybe 80%, comes through their eyes? Yet vision problems often get missed until, they start affecting school or how kids interact. So today, using sources like a really helpful article from Omega Pediatrics, we want to unpack why early vision care is just so vital. It's not just about seeing clearly, it's really about unlocking your child's potential. Okay, let's get into it.
That's exactly right. And what's really interesting here is shifting the mindset, moving beyond just reacting when there's an obvious problem. It's more about being proactive. Yeah. Building that strong foundation for their learning, their overall health. It's frankly more complex than a lot of people think.
I couldn't agree more. So to kick us off, our source helps clarify something important. What exactly is an ophthalmologist? It sounds like it's more than just the person who checks your vision, right?
Yeah.
Especially for kids.
That's a really great point to start with, yeah. An ophthalmologist is, first off, a medical doctor, an MD or a DO. So they've done 4 years of med school, then a really intensive 4-year residency focusing just on eyes. That training is key. They don't just do eye exams and prescribe glasses or contacts. They're specialists. They diagnose and treat all eye diseases. They perform complex eye surgery, manage really difficult conditions. And if you think about kids, well, their eyes are still developing, right? So that medical expertise is incredibly important. Something that seems small could actually have big long-term consequences if it's not handled correctly by a specialist. Think of them as highly specialized architects for vision.
Okay, that makes a huge difference. Knowing their medical doctors really highlights the scope. It's about the health of the eye, not just the vision part. So this is where it gets really practical for parents listening. The source lays out 3 main areas where you should think about seeing an ophthalmologist for your child. Let's break those down. First up, the most obvious one perhaps, vision problems.
Yes, exactly. The article points to common things like nearsightedness, that's myopia, or farsightedness, hyperopia. But it's not just, oh, my kid needs glasses. If these aren't corrected, especially when they're young, it can seriously impact their learning, their coordination,
Yeah.
even lead to things like amblyopia. That's lazy eye.
Ah, lazy eye. I've heard of that.
Right, and amblyopia is fascinating and a bit scary. If one eye isn't seeing well, the brain starts to favor the stronger eye, and the pathways for the weaker eye they don't develop properly.
Mhm.
And the critical thing here, after about age 7 or 8, the brain's visual system is pretty much set. So trying to fully correct it becomes much, much harder, sometimes impossible. It's not just about seeing letters, it's about depth, coordination, fully engaging with the world.
Wow, that's a really powerful point about amblyopia, that critical window for fixing it. Every parent needs to know that. Are there other signs, maybe more subtle things parents might miss before it gets to that point, before it affects school?
Oh, absolutely. And this is where just watching your child is so important. You're the expert on your kid, right? So beyond the obvious, like squinting or sitting super close to the screen, look for frequent eye rubbing. Or maybe they tilt their head a lot. Or cover one eye when they're trying to focus. Even being unusually clumsy could be a sign. Sometimes difficulty with things like drawing or reading, or maybe they just lose interest in those activities. Heck, sometimes even behavior issues or a sudden dip in grades can actually be linked back to vision because they're struggling to see clearly.
That's incredibly helpful. Things parents might not immediately connect to eyes. Okay, so beyond vision correction, another really common reason kids end up needing specialist care is eye infections. The dreaded pink eye, conjunctivitis, we've all been there. But when does a common infection cross the line into needing an ophthalmologist?
Right, pink eye is everywhere in schools and daycares, it seems. And yeah, your pediatrician can often handle the simple cases, but there are definitely red flags. Like if the infection just isn't getting better after a few days of treatment, or if it seems really severe, that's when you need a specialist. Also, look out for intense eye pain, not just discomfort. Or if your child becomes really sensitive to light, we call that photophobia. Blurry vision that doesn't clear up or swelling around the eye itself. Those are signals to escalate things. Because some infections, if they're not treated properly or if it's a more serious type, can actually cause long-term damage, like scarring on the cornea. An ophthalmologist has the tools to figure out exactly what's going on and give the right treatment.
That really drives home the point. Not all pink eye is the same. Good to know those red flags. And then the third category the source mentions is chronic conditions. Specifically, it brings up juvenile arthritis affecting the eyes. That sounds pretty serious, and maybe not something parents would link to eye health automatically.
It is serious, and it's a connection that often surprises people. It really shows how interconnected everything is in the body. Certain conditions that affect the whole body, like juvenile idiopathic arthritis or JIA, can also attack the eyes. The same inflammation that affects their joints can cause inflammation inside the eye, a condition called uveitis. And uveitis can lead to vision loss if it's not caught and treated. What's tricky with kids is they often can't tell you about subtle symptoms, maybe some mild pain or slight redness or light sensitivity. Sometimes there are no obvious symptoms. It's silent.
Wow, silent. That's scary.
It is. That's why for kids with conditions like JIA, regular eye screenings by an ophthalmologist are absolutely essential. They're looking for those signs of inflammation that a general doctor might miss. The powerful reminder that eyes can be a window into overall health.
That's truly eye-opening. Linking those body-wide conditions to eye health really underscores the need for a specialist.
Okay, so let's say a parent notices some of these signs, they make the call, they schedule the appointment. What actually happens during a pediatric eye visit? Our source gives a roadmap, but can you walk us through it a bit more, make it less intimidating?
Absolutely. So you can expect a really thorough eye exam, but it's definitely tailored for kids. It's not just reading that standard eye chart, especially for little ones who can't read yet or maybe can't communicate clearly. Pediatric ophthalmologists are actually really creative. They use pictures, shapes, special lights. They might watch how your child tracks a toy. All this helps them check visual sharpness, eye alignment, depth perception, color vision, and just the overall health of all the eye structures inside and out. They might do something called retinoscopy, shining a light into the eye, which lets them measure vision objectively without the child needing to say anything. After all these tests, the ophthalmologist will figure out the diagnosis, identify what's going on. Okay, that sounds pretty comprehensive, but also kid-friendly. And then comes the diagnosis. What about the treatment plan? That's what parents really want to know. What are the solutions?
Right, the solutions. So the treatment plan is always very specific to the child. It could be medication, like special eye drops for an infection. It could be prescribing glasses. And often the prescription is designed to help the eyes develop correctly, not just make vision equal.
Yeah.
For something like amblyopia, it might involve patching the stronger eye to force the weaker one to work. And in some cases, for more complex things like, say, crossed eyes, that's strabismus, or maybe cataracts they were born with, surgery might be needed. But the goal is always the same: restore or protect the best possible vision and eye health for that child so their eyes can develop properly as they grow. What's really key for parents to understand is that these plans are carefully designed for their child's specific age and needs. It's all about the best long-term outcome.
It's so clear how vital this specialized care is, not just for sight, but for their whole development. But how does this specific focus on eyes fit into the bigger picture? A child's overall health journey. It doesn't happen in a vacuum, does it?
Absolutely not. That's such an important point. If you think about the bigger picture, good pediatric care is always holistic. It looks at the whole child. Eye care is one piece. But so are regular checkups, treating illnesses, getting immunizations, support for things like nutrition or allergies. It all works together. A really strong pediatric practice, like the one our source article comes from, understands this. They often offer a whole range of services, maybe lactation help for new moms, developmental checks for toddlers, sports physicals for teens. This integrated approach means that specialized needs, like eye care, get addressed within a system that supports the child's entire health. Nothing gets missed or treated separately. It's about creating a complete health safety net.
That holistic view is just so valuable, isn't it? Especially when you're trying to make the best decisions for your child's health. And thinking practically, our source also touches on making this care reachable. Good practices know this. They often work with lots of different insurance plans and set up clinics in various communities, making sure families can actually get this vital, specialized care, like for eyes, wherever they live. That accessibility piece is huge. So what's the main takeaway for everyone listening? I think today really highlights how important it is to be observant, proactive about your child's vision and eye health. From understanding what an ophthalmologist really does to knowing those key signs that mean it's time for a visit, whether it's a vision issue, an infection that won't quit, or maybe something less obvious linked to another health condition. Hopefully you feel better equipped now to support your child's development and make sure they're seeing the world as clearly as possible.
Indeed. And remember, catching things early with kids' eye health can honestly prevent lifelong problems. It can make such a difference to their quality of life, their learning, everything. Don't ignore those little signs or feelings you might have. Never, ever hesitate to get expert advice if you have any concerns at all about your child's eyes. It's always, always better to check it out.
Absolutely. And on that really crucial point, if you are concerned or if you just want to learn more about the comprehensive pediatric services we've talked about, we definitely recommend visiting omegapediatrics.com. They have a wealth of details and resources there. They're available to offer expert advice and support with no obligation, which is just fantastic for parents seeking information. That's omegapediatrics.com. And hey, if you found this conversation helpful today, please do give this video a like, subscribe to the channel for more on children's health topics, and please share it. Share it with friends, family, anyone you think might benefit from this information. You never know who needs to hear this.
Thanks so much for joining us as we explored pediatric eye care. Keep questioning, keep learning about health information, and always think about the long-term impact of the choices you make for your children's health early on. Their future view of the world really starts now.
So true. Until next time, stay curious, stay well, and keep those little eyes healthy. This has been Have More Babies. We'll see you soon.